What's up everyone, welcome back to my channel, or welcome. My name is Lori. If you are new here, I am a family nurse practitioner and I currently work in the urgent care space. This video is going to be a quick video talking a little bit about abdominal pain, when to go to the emergency department, when to go to the urgent care, and if you are a clinician, when to send your patient to the ER if they come to the urgent care, or when you're kind of comfortable to say you can go home. Now, the abdomen is very complex. And I'm not going to do an entire video about the organ that's in the right lower quadrant, the organ that's in the left lower quadrant. You're probably past that stage. And if you're a lay person, you can look that up and it'll be definitely there for you to see. Now, I do want to say that if you feel any discomfort in the abdomen, you should have it checked out if it's been going on for a significant period of time. I will say if you're having abdominal pain over 5 or 6 days, you need to check that out and see what's going on with it. Also, if you're having sharp sudden pain to the abdomen, you need to probably go to the emergency department. If you have rigid distension in that belly and it's tender to touch, or we say tender on palpation, do not waste your time and go to the urgent care. Go straight to the emergency department, because I will tell you that majority of urgent cares only have an x-ray machine in the facility. We do not have ultrasound. We do not have the capability to do a CT scan, and majority of us do not draw blood. A lot of times when patients are having abdominal pain, a lot of patients think of their appendix, especially in kids. If your patient walks into your urgent care and they're complaining about abdominal pain, you kind of want to start from the beginning. It's almost like you're formulating your SOAP note, right? So you're getting your subjective data, your objective data, then you're going to go to your assessment and your plan. The subjective stuff is what the patient is telling you. Your patient is saying, listen, my stomach has been hurting for 3 days. You need to ask, what type of pain is it? Is it acute? Is it sharp? Is it aching? What is precipitating this abdominal pain? Ask if the pain is radiating anywhere. Is it radiating to any other parts of the body? Is it radiating to the chest? Is it moving anywhere else? Also, make sure you're asking them if they're tolerating liquids or solids, or if they are vomiting or having any diarrhea associated with the abdominal pain. Make sure that you're doing a thorough history on the patient. You need to ask the patient if they're on any medication, because remember, NSAIDs can cause abdominal pain. Sometimes antibiotics can cause abdominal pain. Ask them if they have any history of GERD. If they have any history of diverticulitis, do they have any history of sickle cell? And if the patient is probably going into sickle cell crisis, make sure you get a detailed history on this patient on top of your proper assessment, physical assessment that you're going to do. Also, remember the psych. Depression, yes, depression, and also anxiety can cause abdominal pain in patients. Ask them about any trauma. Was there any trauma to the abdomen? Because you want to rule out kidney laceration, liver laceration as well. When you go to assess your patient's abdomen, you want to make sure that you do your Ravsine sign, your obturator sign, and your psoas sign. I'm gonna put on the screen what these are. When you're trying to rule out appendicitis versus, I would say, acute gastritis, just remember that with acute gastritis, the patient typically vomits before they feel the pain. And with appendicitis, the patient typically experience pain before they actually vomit. I said before that x-ray is not the best tool for the abdomen. Ultrasound and a CT scan is the better tool, but I do utilize my x-ray machine in my clinic because sometimes, especially with kids, they're constipated, and I will send a child home, and this is my rule to this. If the child comes in, or the adult, but I am really careful with these kids because it's hard for kids to tell us sometimes what they're truly feeling. And all my assessment is negative, and all the history that I'm asking the parents is negative, and no tenderness on palpation. They have nice bowel sounds. You know, sometimes the bowel sounds would be a little low, but the bowel sounds are there. If they have zero bowel sounds on auscultation, you need to send them to the emergency department. Like, why don't you have any active bowel sounds? And I do an X-ray, and X-ray is telling me that they have constipation, and they have no fever, no vomiting, no tenderness. I do feel comfortable in treating the kids for constipation, and then I give strict, and I mean very strict, guidelines to the parents of when to take them to the emergency department. And I always tell parents this, or adults, because this is for both that I'm saying, if you are being treated for, like, say, constipation, and this abdominal pain is not going away and it's worsening, don't go back to the urgent care. Go to the emergency department, because the urgent care is not going to be able to do anything else for you, because we have exhausted everything that we can do for you. When it comes on to women, make sure that you are doing a pregnancy test on them. Yes, because I have had 3 patients in the urgent care so far who came in with severe abdominal pain, and I asked any chance of pregnancy, and they said no, and they were pregnant. So you're having severe abdominal pain and you're pregnant, you definitely want to go to the emergency department to see what is going on. One of the things that I do on every patient that comes in with abdominal pain is a urinalysis, because that's one thing I can do in the urgent care setting. I don't draw blood, like I said, so the urinalysis a lot of time can tell me if there's any urinary tract infection. If I'm seeing a lot of protein in that urine and they're having a lot of abdominal pain, I'm sending them to the emergency department, because I want that kidney to be checked out. Because if I'm touching your belly and you're jumping off the table and then this high levels of protein in your urine, you have to go to the emergency department. I'm not gonna send you home like that. And I've had patients before who was upset and said, just put me on antibiotics. And I'm like, no, I'm not just going to throw you antibiotics. We need to follow this through. Also, some patients will come in and say, I have a history of diverticulitis. I know it's flaring up. Can you just give me some antibiotics? Absolutely not. I will not do that. If you have a history of diverticulitis and you believe that it's flaring up, you have to go to the ER to get that checked out, because what if it's not your diverticulitis that is flaring up? I'm just saying. Do not forget about diseases like Crohn's disease. I had a patient that came in complaining about abdominal pain, and she had said that she had lost weight, and I said, were you trying to lose weight? And she said no, she wasn't trying to lose weight, but she noticed that she's losing weight. You need to send those patients to the emergency department to rule things out like Crohn's, like I said, because that is the reason why I said a proper history will determine what your decision making is going to be. Don't be afraid to ask questions to your patients, because that's why they're there. They're there for your help, and they're there to seek knowledge from you as the clinician. So make sure you're getting a very good history on these patients. So there you have it. Quick reminder and tips. This video could be 2 hours, because when I tell you there's so much that can be going on with abdomen, but I wanted to make it short as much as I can. Thanks for watching, and I'll catch you guys in the next one. Bye guys.